Hello, this is Anna Galetli, and we are now going to start on Unit 8, and this first video lecture is going to be looking at the gross anatomy of the respiratory system. So when we start looking at the gross anatomy of the respiratory system, we actually want to divide it up into two sections. You've got the upper respiratory tract and the lower respiratory tract, which is also called the respiratory tree, okay? So you can just see how this is basically dividing up those areas, okay? So you're going to want to learn those different sections, and we're going to start going through them in a little bit more detail. As we start going further along, especially as we get to the histology, we're going to talk about the difference between the conducting zone and the respiratory zone. The respiratory zone is where you're actually going to have thin enough tissues that you can actually do gas exchange. Whereas the conducting zone, you're just moving the air from one place to the next. So you're conducting the air along a pathway. All right, let's move to the next slide. So let's start at the very top. You've got your nasal cavity, okay? Then you've got your pharynx, which is basically this section, okay? And you've got the oral cavity up there. Now, the pharynx, we want to actually divide up the sections based on what they are behind. So, right here, this is the pharynx that's posterior to the nasal cavity. So it is called the nasopharynx. Okay. This section is behind the oral cavity, so it is called the oropharynx. And then this section is behind the opening to the larynx, so it is the laryngopharynx. Okay? Then down here, you're going to transition, and now you're in the esophagus. Okay? And then anteriorly, it goes into the larynx. And then I kind of use this boundary line where you start getting tracheal rings, and your your inferior to the thyroid cartilage, to basically define, that's the wrong word that I'm writing, where the location of the trachea is, okay? So here you're dealing with all one tube. Then you start dealing with two tubes, okay? The esophagus is going to continue with solids and liquids, and then air is going to be going into the anterior tube, which is your larynx and trachea. All right, let me get rid of this mess. And let's look at these other structures. So you will remember from A&PII when you did the bones, you talked about the nasal conchae. We have the superior, the middle, and the inferior. These two are separate bones, whereas the superior one is part of the ethmoid. And you should remember that. Now these are little ribbons or curls of bone that then the mucosa wraps over, and they increase air turbulence in the nasal cavity. Okay? And that's important because it allows you to collect debris out of the air. It allows you to humidify the air. It allows you to humidify, warm or cool, and then odor molecules to drop into the respiratory membrane so that you can smell them, okay? Now, you can see right here the sphenoid sinus, and then here you can see the frontal sinus. So those should be refreshers for A&PII as well. Now, you're going to have a little opening right here for the auditory tube, which I learned as the eustachian tube, and most doctors that I've been to, most pediatricians that I've been to, they still call it the eustachian tube, so you need to remember eustachian tube as well as auditory tube. Now, back here, you will see one of the three tonsils that we're learning, which is the pharyngeal tonsil. So basically what I want you to remember is that it's located at the top of the pharynx or the superior pharynx, so its name is pharyngeal tonsil. Then we have two tonsils that are associated with the palate. So it is called the palatine tonsil right there. And then at the base of the tongue, you have your lingual tonsil. So 1, 2, 3 tonsils. They're named based on where they are located. All right, let me get rid of some of this mess. Oops, that's not erasing. Why is that not erasing? That's interesting. Okay. Anyway, the next thing is, you're going to remember from A&PII, you've got the hard palate here, which is made out of bone. And then you've got the soft palate here, which is made out of tissue. Okay? That palate is going to extend down, and in the middle, the midline at the back of your mouth, of your oral cavity, you will have a structure called the uvula. So that's the thing when you watch Bugs Bunny and they like do a zoom up into his mouth and it shakes when he's singing. That's your uvula. So the palatine tonsils are on either side of the uvula. Okay? Here is your tongue. You've got salivary glands all over the place. But what I want to focus on next is the outline of your epiglottis right here. So the interior of the epiglottis is going to be elastic cartilage, and then it's going to be coated with stratified squamous epithelium right here. You will see attachments to ligaments that attach it to your hyoid bone. All right, the hyoid bone tends to not get a whole lot of attention because it's a floating bone and it's not very exciting, except it is really exciting. All right, this hyoid attaches to the epiglottis, and every time you swallow, you tighten up these muscles. That is going to pull on this stuff, and it basically pulls at the base of this and causes the epiglottis to go down like a shelf, so that when stuff starts coming down here, it hits the shelf, and instead of going this way, it goes towards the back. So it's a really, really important structure, incredibly important. This is what keeps us from choking. Plus, if you strangle someone with your hands, it fractures the hyoid, and that's really cool when you get dead bodies out in the woods. Okay, I think that's everything on this slide, so let's move on. Okay, so I already went over the pharynx and showed you the sections. This one is nice because they color code it so that you can see it really easily where the different sections are. Okay, now up here, I want you to focus on the nasal septum. So the word septum, you should already know, means wall. All right, so this is a midline wall. This is bone, and this is bone, specifically from the vomer and the perpendicular plate of the ethmoid. Okay, then the thing that you can put your beautiful little ring in, all right, if you want to pierce your nose, is actually hyaline cartilage. Okay, so the nasal septum is composed of 1, 2, 3 parts. 2 which are bone, 1 which is hyaline cartilage. You should know that. And you should know this, all right, here. All right, that the perpendicular plate, which is part of the ethmoid, creates part of the nasal septum. This is a refresher from A&PII. So this is why we are learning that bony structure, so that we can visualize that septum. Okay, so we just went over the upper respiratory tract, and you've probably been to the doctor and they've talked about, oh, you have an upper respiratory tract infection, which basically means it's somewhere in your nasal cavity or in your pharynx area. If you have a lower respiratory tract infection or a bronchial infection or a pulmonary infection like pneumonia, you are talking about this stuff. Okay, so this can also be called the respiratory tree because it kind of looks like a tree. So you've got this part, which is your larynx, and we'll talk more about these structures. You got the thyroid cartilage, you've got ligaments, you've got your hyoid right there. I should probably switch from yellow because it's hard to see. Then you've got this section, which is the trachea. Now that's going to split into the 2 primary bronchi, or primary, why did I do that? Bronchus is singular, bronchi is plural. Okay, now you will notice that in this picture they're calling it main. You can also call it primary. Okay, and on this one they're calling it lobar, but it's also called secondary. Okay, and then they're calling those segmental, and I'm not even seeing the tertiary, which is kind of intermediate between the secondary and the segmental. Now, you do need to know both of these words. I honestly don't care which one you use on a test, all right? But you need to know both of them because both of them are commonly used. I learned primary, secondary, tertiary which means most of the people who are actually working in clinics learned primary, secondary, tertiary. Newer books are using the system of main lobar, so you just need to know both. Okay, so the primary bronchus, you've got one going to the right and one going to the left. Then those split into the lobar or secondary, so you've got one here and one here. Now this is your left lung, which you can tell because it's got this space for the heart right here. Now the nice thing about here is each one goes to a lobe. All right, so on the left, I have 1, 2 secondary bronchi, okay? Over here, I have 1, 2, 3, because on the right, I have an upper, middle, and lower lobe, okay? Now, all of these bronchi keep getting smaller and smaller until we start calling them bronchioles. And then the bronchioles continue to get smaller and smaller until we call them alveolar ducts. Now we're in the respiratory zone. So everything that we're looking at here is going to be conducting zone, which basically means you cannot do gas exchange in these areas because the tissue is too thick. All right, let's look at the next slide. All right, this is my note slide, which defines all of your boundaries. I'm not going to read it to you because I've already said it all, but you can go back to this and refresh your memory, okay? All right, so we're going to back up here a little bit. And we're going to look again at the upper respiratory tract. I should have probably put this slide further forward. So I want you to notice what they're doing right there. So this is in the sagittal plane, whereas here, this is in the coronal or frontal plane. So when you come over here, you can see really nicely the nasal cavity. So this is a lateral wall. This is where you've got your olfactory membrane here. You've got the opening, all right, so this is going to be stratified squamous epithelium. All of this is going to be PCCE, pseudostratified ciliated columnar epithelium, down into the pharynx, the nasopharynx, which is also PCCE. And then when you get down into the oropharynx, you switch to stratified squamous epithelium because you're eating tortilla chips, okay? So this is just giving you a different view or a different picture showing you the section right here. Now let's go over and look at this one. I'm not going to test you off of this view, but it will be an APR, and I think it's neat, okay? The reason I think it's neat is because of the way you can see right here your perpendicular plate of your ethmoid. This is your ethmoid. This is where the cristogali is here. Now you can see nicely the superior nasal conchae and then the inferior and middle nasal conchae, okay? And you can see the vomer bone right here. I think it's a really nice view, okay? So just kind of look at it so that you can understand those nasal conchae a little bit better along with the vomer and perpendicular plate. All right, let's go on. All right, so back to our lower respiratory tract. Let's look at the larynx a little bit more closely. So here you've got your anterior view and you see the thyroid cartilage. Make sure you put the word cartilage because we have a thyroid gland, and usually when people don't specify, they're talking about the gland. So you need to say thyroid cartilage, not thyroid. And then right here, you've got the cricoid. Now I want you to come over here and look at the medial section. And so this is the anterior, this is the posterior. And what you can see is this thyroid cartilage right here, and then the cricoid cartilage right here. And you'll notice that anteriorly, cricoid is short, whereas it's taller posteriorly, okay? Now, notice what the thyroid and cricoid are doing. They are in front of this structure. This is your voice box. The bottom is called the vocal cord. You can change that word out for fold. Vocal fold, vocal cord, both of them are the same thing. It's always on the bottom. Sitting on top is a protector called the vestibular fold. The vestibular fold does not move. It's just a shelf that sits on top of the vocal cord. Don't get them flipped. Okay, so then here you got that whole cricoid cartilage, And then you've got 1, 2, 3 tracheal rings, which are also made out of hyaline cartilage. Okay, so over here, 1, 2, 3 tracheal rings. Now here you've got nice ligaments going to your hyoid bone, and then there will be ligaments that go from your hyoid to the base of the epiglottis. So let's come back over here to this picture. So here is your hyoid. Here is that ligament going over to the epiglottis. So that is your epiglottis. When this tightens, it takes this part and lifts up. That causes this part to go down, which basically makes a shelf so that when stuff starts going down, it bounces and it goes towards the back into the esophagus instead of into the larynx where you're going to choke. Okay? So now let's look at this posterior view, and you can see the shield of your thyroid. You can see the posterior aspect of the cricoid. You can see the little tracheal rings, 1, 2, 3. Notice that they are broken right here. You want room for your esophagus to expand when you swallow something really big. So you break the tracheal ring so that you can kind of bulge inward when you need to. Okay? And here you can see the shape of the epiglottis. Now they've taken everything out but the elastic cartilage in that view. Okay? All right, I think that's everything on this picture. Let's move on. All right, here's just a cadaver specimen. So you can see the thyroid cartilage, you can see the cricoid, and right there you see your thyroid gland. So I want you to go and feel your thyroid cartilage right now on your neck. So I'm pushing on mine. In men, we call this the Adam's apple. All right, and then if you kind of bring your hands, your fingers just a little bit inferior and lateral, you can actually palpate your thyroid gland. And when you go to the doctor, they will do that to kind of, make sure that it's not hypertrophied and indicating an thyroid disease. Okay, all right, so move on. All right, so here's a nice view from your APR, and we're looking at the posterior of the larynx. So you can see where they've cut away the esophagus so that you can see the membranous part of your trachea. You can see a little bit of the cricoid. You've got the arytenoid muscles here and here. But mostly what you're noticing is this epiglottis here and a little bit of the hyoid. Okay? So you can play with this in APR and turn the labels on and off so that you can practice. Moving on. All right, so again, another picture from APR, so you can practice on this with and without the labels. What I like is that you can see really nicely your thyroid cartilage here, and then the cricoid, I brought that down a little bit too low, cricoid cartilage here and here. The arytenoid cartilage here is going up, and it's actually going to anchor your vocal fold. And when this area, when the arytenoid muscle contracts, it actually changes the shape of your vocal fold. And then on the top, you have the vestibular fold, okay? And here, why is the arrow not going on? So this right here is your epiglottis. And so then this is the pharynx, this is the larynx, and this is the trachea, and this is the esophagus. Okay, let's go to the next slide. All right, so here's just a quickie view, and this is the glottis. So the glottis is just the hole going down your larynx and trachea, okay? Epi means about or around, and so you can see the epiglottis is kind of forming a hat that, or a flower petal that when you pull on the base goes and covers this, preventing liquids and foods from going into that structure. Now here you can see the vocal folds very nicely, and then this is the vestibular. Okay, so in humans we don't move our vestibular one, we only move our vocal one. And you can see, I want you to visualize this and commit to memory. The vestibular is a shelf on top of the vocal. All right, next slide. All right, so here's another view from your book, and you can see the different parts of the larynx and the trachea. But what I want to show you, getting rid of some of the clutter, are the two primary bronchi, all right, also called main, and then the two lobar, also called secondary. So I'm going to write those down there. okay? And then on the right, you've got 3 right here. Then depending on your book, they're calling these segmental. I've always learned them as tertiary, but you can use either term. And then these are going to continue and become subsegmental, and then large bronchioles, and then and it gets smaller and smaller and smaller, okay? Now let's come over here and look at this picture. So what we're doing is we're taking a section, and you can see the PCCE of the mucous membrane here. And then there'll be a thin layer of areolar CT, and then you've got submucosa with various glands within it. You can see how the goblet cells here are secreting mucus, which moves along the surface in response to the cilia, which are waving. And you can see the chondrocytes of the tracheal cartilage. So this is hyaline cartilage, okay, in the tracheal rings, okay? Now, let's look at this picture right here. So you've got the lumen of the tube. You can see the mucosa here, and then you can see the tracheal ring, which is the cartilage, and then you've got a adventitia that surrounds it, okay? Notice that there is no cartilage right there, so that this tissue can push inward if you swallow a big piece of burger because you didn't chew well, okay? All right, next slide. All right, zooming in, you've got a primary, you've got a secondary, you've got tertiary, also called main, lobar, or segmental. These are going to get smaller and smaller, and they call this a smaller bronchi. And then notice that you start to lose the cartilage. At about then, we're going to start changing the name to bronchioles. Okay, and you get large bronchioles, then you get terminal bronchioles, then respiratory bronchioles. Notice there is no cartilage. You are slowly getting rid of the cartilage here as you go smaller and smaller. And here it's definitely gone, no cartilage. Now, when you get to the respiratory bronchiole, you're going to switch from from a cuboidal epithelium to a simple squamous epithelium. Okay, up here you got PCCE. Down around in here, you're going to switch to simple columnar, then simple cuboidal, and then when you switch to simple squamous, that is when you can do gas exchange. Okay, so let's look at this section. All right, you have smooth muscle that's going to wrap around these bronchioles, and they're going to be able to contract and relax. When they contract, notice that they make that much smaller. When they dilate or relax, they pull it open. So this basically means you increase the amount of airflow into that section, okay? All right, one more slide. All right, so we haven't talked about this yet, but, well, we did, sort of. You've got on the right and the left. Left has 2 lobes, right has 3 lobes. Memorize that. This one is called the upper, this one is called the lower. We also call it superior or inferior, okay? On the right, we have upper, middle, and lower, also called superior, middle, or intermediate, and inferior. So you can see we got different names for everything because this is an A&PII, and we are not happy unless we have multiple names for the exact same thing. Okay, now we got 2 fissures that you're going to memorize. On the right, you have the horizontal and the oblique. And on the left, you have just one, which is a single oblique. Now here, this section that's been cut out of the left lung, so the left lung is smaller. If you have to choose to lose a lung, go for the left because, you do less gas exchange there. Try to keep your right. So no cancer in your right, please. So this is called the cardiac notch. It's also, well, here they're calling it the cardiac impression because, again, it's A&PII, and we have to have multiple names for the same thing. Okay? So those are the sections. Now this is also nice right here because they show you how the main or secondary is going to 3 different lobes. Okay? All right, so that was the last slide on part 1 for your respiratory system anatomy. So the next video lecture, we will be talking about the histology more.